So how do you work with patients, because now you're starting to get attention out of state? How do you work with these patients?
Right, so I have patients who fly out to see me from New York, from Florida. They come from outside Northern California.
Yeah, what are the rules? I mean, what can
So the
you
rules
do?
are we have to meet with them once. I have to examine them. So they come to my office, we meet for 2 hours. I take a full medical history. I do a carotid ultrasound. I do body composition testing. I listen to their heart. I listen to their lungs. I take a full medical history. And then what we do is we follow up over the phone. I send them to the lab in their area. So my patients that are in Tampa, they go to a lab core in Tampa. And we check their blood levels. We hop on the phone. We hop on Skype. We do all their follow-ups. And then they come out and they fly out to see me once a year.
Do you have a few of those, by the way, that the people are feeling good?
I have patients who will fly out from Tampa every single year, and certainly New York, which is my home state. They fly out to see me because they feel amazing. So if you're a patient and you're out of state, you have to come by law to California once, come in my office.
And you're in a beautiful place. I mean, you're in Orange County, California.
Yeah, I'm in Orange County. I'm 5 minutes from Newport Beach and Laguna Beach. It is really an amazing place to visit. So I do have some patients say, I've been meaning to get to Southern California. This is going to be the reason why I come out now. I'll have an excuse to get out there. So if you're out of state, it's no more difficult than it is if you were living in Irvine, where in my office. Now, my patients in Irvine can actually come in and see me as often as they want to, but with Facebook, with Skype, with email, with phone, really you have access to me just as if you were living in Orange County. So it really is a nice way to practice.
Okay, good. So for these out-of-state people, so you're available by phone, by Skype, and again, if they want to get started out of state, they just call your office.
Yeah, they
go to
call
your
my office.
website.
I send them for blood work. They get their blood work done locally. I get their blood work back, and they schedule an appointment. They fly out to see me. We sit down for 2 hours, and then they fly back home, and their hormones get delivered right to their house. And I could work with them on nutrition. I could work with them on everything else as if they were living in Orange County. It's really nice.